Oh! All that impact onto the neck is a serious injury.
Saudi, this is what you wanted. You're going viral, Roman.
Whoa! This is obviously staged, but even staged, this is high risk. And what happened is this guy actually tore his MCL. So the MCL is called the medial collateral ligament in his knee. It stabilizes the knee from bending inward too far. Some of the causes of injuries like this happen in sports all the time, but it could be a direct blow to the outside of the knee. The treatment for this is rest, ice, compression, and elevation for the pain and swelling, and physical therapy. Surgery is rarely needed for an isolated MCL. Oh! Oh my God. Look. Oh boy. Ay. Ooh. So this is a broken neck injury or cervical fracture that happened to this individual. All that impact onto the neck is a serious injury, especially when one or more of the vertebrae are broken, because the spinal cord kind of runs through these vertebrae. A broken neck is a medical emergency that can produce damage, paralysis, and even death. In this case, you do not move the person until trained medical professionals arrive.
Just look, here he goes, crossing himself.
Ooh. Wow. Once again, this guy flipped and landed right on his head. He was completely knocked out. This can also cause a neck injury like I described. This can cause all sorts of shoulder injuries. Basically, he had a concussion. This type of physical trauma many times is a temporary disruption of normal brain function. Any loss of consciousness should be treated as medical emergency. If these are repeated over a few times, it can cause severe neurological and brain damage. Oh, double flip, and he gets the knees in the gut. The other guy obviously saw it coming and protected himself by putting his knees in his gut. Now, this is a huge force which basically can push the diaphragm up. It's called knock the wind out of you. Then you can have air hunger sometimes for a few minutes and sometimes actually loss of consciousness. It is possible that you could also get some rib fractures with this. And in that case, things could be a lot worse because you could have some organ punctures from your rib fractures. Oh, this guy had a huge impact right on his shoulder. Once again, this could have been a lot worse, but shoulder injuries generally have a few types. They generally are rotator cuff injuries, where the rotator cuff is a group of muscles and tendons that stabilize the shoulder. So when you lift and rotate your arms, multiple injuries can later develop arthritis, the loss of the cartilage on the ball and the socket of the joint. Here we go. Another high risk maneuver, jumping from the top rope. And oof, she falls and she falls right on her shoulder and breaks her clavicle. This is a heavy, heavy injury there. Collarbone fracture, also called a clavicle fracture, is a break in the long bone that runs horizontally from the sternum to the shoulder blade scapula. It's one of the most commonly fractured bones, particularly in children, adolescents, and athletes doing contact sports. So this is diagnosed usually with an x-ray. Most commonly, these aren't treated surgically. Usually these are treated with immobilization and a sling, pain management, ice application, and physical therapy. So she also had loss of consciousness, and they were very concerned about possible neck injury. And so that's why they had her on a stretcher. They had her completely immobilized. It looked like everything was done right. And then she was immediately seen by a medical health care expert professional in this field. Okay, so this is an old cranion or elbow injury. Basically, it's an old cranion bursitis. The specific cause is usually caused, like in this case, a sudden direct blow onto the area, which can cause severe inflammation and swelling. The treatment of this is pain management, ice, sometimes a sling, and occasionally drainage of the area to remove the fluid is necessary, which might take a few times to drain it. You can see right there that egg-shaped appearance right there. Occasionally, if this is associated with other injuries of the elbow, surgery might be warranted. So that's one that could be chronic as well, and chronic ones have more tendency to lead to bony injuries and arthritis, which needs more treatment from an orthopedic upper extremity surgeon. Okay, look at that. Ouch. Knee to the nose, causing a broken nose. Wow. So this can be rather painful and in some cases can be rather dangerous. But this can be caused usually by contact sports such as this. This may lead to a crooked, misshapen appearance of the nose. You might have difficulty breathing. You might have some grinding or crackling sensations when you touch the area. If it's like this, though, severe fracture, it's twisted, it's out of alignment, usually what we do then is called a closed reduction. You can inject some local anesthesia or done under sedation, where you kind of pop the nose back into place and put a cast on. The potential complications with this is the inside is you can have a deviated septum, which can lead to breathing problems. With any broken nose, it's important to seek emergency medical care and to check out the injury. You could also have associated other injuries such as head injury, neck injury, and you should always be fully evaluated by a medical professional. Whoa, this is like a cage match. This is a huge fall, falling from an incredible distance, landing on the ropes there. Wow. So that can cause all sorts of injuries from head to neck to shoulder. That could also cause rupture of your internal organs from that far, even leg injuries as well. Those are high risk maneuvers, even though they're staged. They don't always go as planned. And so I recommend not to do those at home. Ooh, wow, look at that. Severe force in the back of the neck, leading to a career-ending neck injury. Once again, this could cause a blow to the back of the head like that, can cause a lot of damage to the neck, which is the cervical spine, which houses the spinal cord. This can lead to paralysis, a loss of mobility, and even loss of consciousness. And something like this could even lead to brain injury as well. You should not move her. Medical personnel should be involved to immobilize her, carry her to the emergency room where she can get x-rays, proper evaluation, and proper care. Wow, there's an interesting one. It's an eye injury. Getting a boot like that to the eye, causing severe injury to the eye. That's kind of an interesting one. This could be caused by a laceration to the upper lid. He's basically has a lazy eye on one side. So what does a lazy eye mean? It's a condition called amblyopia. This can cause vision obstruction, trauma to the eye muscles, which you can see he has a lazy eye because his lid is lowered down. So he may have had damage to the upper lid muscle, which basically lifts the upper lid eye up and down, is responsible for that. There you have it. Some of the most devastating WWE injuries ever recorded. I hope you enjoyed that. And so if you like that, there'll be more on the way.